right. Good afternoon, everyone. My name is Jessica, and I am the head of our training team. We also have Kathy Casparo on the line. She may be jumping in if she thinks of something that I've missed. She is the head of our SWAT team. Today's presentation is on patient relationship management. Now, as you all are, of course, aware, good relationships with your patients not only can cause them to refer you to people they know, but also it helps them to stick to their plan of care. It makes them understand that they need to come in and want to come in to get better and to keep coming in and seeing you. So we have a couple of different tools that will help you manage that in our system. The first tool that I'm going to go over is our radar chart, or we also call it our practice health monitor. This radar chart can be turned on, so it's right on your home screen when you come in every day. And just for those of you who want to know where that old open help request ticket window has gone, it is still available under the help menu, and you can still access it there. So for our radar chart today, I only brought up the 4 metrics that really have the front office staff would have a need to keep an eye on these for the patient relationship management. Those metrics are the no-shows, the new patients, the patient visits, and the daily no future appointments. I'll just go over briefly how this radar chart works. This radar chart compares 2 different months, and you can select those months at the top right. And what it does is, according to the rules for that specific metric, it's going to display the number for that metric. You can see those numbers right underneath. The one on the left-hand side is for the first month, and the one on the right is for the second month that you selected up at the top right. If you click on any of these metrics, you can actually get a line graph that will show you all the intervening time between the months up at the top right, and you can break that down by month, week, or day. But the radar chart itself is just going to show you what those numbers are at the end of the month. So if you are looking at the current month, the radar chart is actually going to show you a projection. It's not going to show you where you currently are, but it's going to show you where you will be at the end of the month if you continue on the track that you are currently on. So to select these...
The conference has been muted.
Okay. To select these different metrics, we're just going to go up to this gear up at the top right, and we have 2 options. For office managers and physician roles, you're going to have the practice config. This is where you can select the defaults for the practice, and you can set the goals. These goals are where you want to be, and the bad column is going to be where you definitely don't want to be, with the number that you're trying not to hit. And then the radar chart will display where you are among that range. So there's also this restricted column where you can keep certain metrics. It basically blocks anyone who is not an office manager or a physician from being able to select that metric. And then you can set the personal preferences. This is just where you would override the default metrics. Now, this is where I selected just those 4 patient relationship management metrics. So as we have here, the no-shows, this metric is going to show you all the patients in a given month that did not show up for their appointment and did not call or cancel or anything like that. What happens is each night the system will look at the past 24 hours and see if any patient is currently on, any appointment is still a no-show. It will then add up all those numbers and it will indicate that on the chart. Again, for the current month, it is a projection, so it's going to look at all the no-shows that you've had already that month, and it'll give you the number where you will be at the end of the month if you continue on that trend. The new patient is actually going to show you all your new patients who have checked in and had an appointment. So if you just create a new patient account, that's not going to be reflected here on this chart. It's only going to show when that patient first had their first appointment and actually came in. The patient visits is just, it counts up the number of patient visits you have in a month. The one thing that you would want to be aware of for this metric is that if you see a patient twice in one day, it's only going to count that patient once. It does look for unique patients in the past 24 hours each night when it's adding up the visits for that day. If you see a patient twice in a month or a couple times in a month, it will count that patient multiple times. It's only if you see them twice in one day where it's only counted once. And the last metric we have over here is our daily no future appointments. This is looking at the past 24 hours for the patients who you saw, who came into your office, but left without making a future appointment. And of course, that's indicating how many you get each day. All right, so that is basically a brief overview on the radar chart, specifically towards the patient relationship management aspect of it. There are, of course, many different metrics that you can choose from, but this is just the ones where it might be a good idea that the front office staff is looking at these. And just a little bit on how the radar chart works. What you want is for the entire radar chart to be covered in that second month color. In this case, it's this light cyan color. That is the current month, and what you want is for the entire chart to be covered in that, because that means that you're hitting your goals. And if you actually do get your entire chart covered in that, you might actually want to look into increasing your goals. The orange or burnt umber, I guess, color is the past month. And if you're seeing more of that than the cyan color, that actually means that you're actually doing worse in those areas than you had been previously. So that could indicate an issue that you might want to look into about what could be causing the decrease in the numbers. So that is just a brief radar chart, this explanation. But we actually do have two other areas that we can use to help with patient relationship management. One of those is the alerts on your schedule. I'm sure some of you have seen these already, where you check a patient in, an alert shows up over to the right, or possibly even pops up, letting you know that something is going on with that account that you should look into. We have three that could be useful for patient relationship management. The first one is this add future appointment rule. This is going to pop up when you check a patient in. And for this example, I'm going to say that we have 0 fewer appointments. So what happens is when a patient checks in and they don't have a next appointment scheduled, this alert would pop up on the scheduler and let you know that, this is the last patient's scheduled appointment. Perhaps you should talk to them about scheduling their next one. The other two alerts that could be useful are the missed visit rules. Now, we do have two of them. We do recommend, depending on how exactly you want the alerts to pop up, if you select more than one rule at a time, both must be true for the alert to show up. So if you're looking for an either-or type alert, then you're going to want to make two separate alerts. So for the first alert, it is total missed visits. This is showing you, this will pop up when the patient next checks in, because this does pop up only upon check-in. So this would pop up when the patient next checks in and if they have hit a total number of missed visits. So let's say that they have missed more than 5 total visits. And if they've missed that many visits, this would pop up, and then you can talk to them about why it's important that they come in for their visits and that type of thing. If you have any need to, you could actually restrict it by using some of the date rules as well. So if you only wanted to see, if they've missed a certain number of visits this year, in the past month, whatever you would like. The second missed visit is the consecutive missed visit rules. This is if the patient has missed a certain number of visits in a row. So you can come in here and turn that on, and if that patient checks in and perhaps they've missed their past 2 appointments, that is when this alert is going to show up on your scheduler, and you can then talk to the patient then. Again, you can always use one of the date rules if you'd like to restrict it a little further. What I'm showing here now is the patient-specific alerts, but you do have the option of showing these practice-wide by going to Configuration Practice Schedule and onto the Notifications tab. It is the same exact set of rules. All this does is allow you to set the rule once, and then anytime any of your patients meet the criteria for the alert that you set up, it'll go off for that specific patient. So that is our scheduler alerts that could be useful for you for patient relationship management. The last tool that we have are tickets. Now, we use tickets all the time, communicating with all of our practices and internally trying to get tasks done. So this is useful the same way. What happens is when a patient either no-shows and then not cancels, but just doesn't show up and they are not contacted that day, and then the appointment updated as a cancel with a reason, or if the patient has no future appointments, they came into your office that day and then they left without making an appointment, these tickets can open. Now, these are set, they open up overnight, so you have until probably, maybe 10 o'clock at night to catch up on all your appointments and marking those who canceled and entering the scheduled appointments that you need to. But that night, these tickets will open up, and we have 3 different kinds. We have tickets that if the patient they didn't show up, but they do have a future appointment, there is the no-show ticket. If they showed up for their visit and then left without scheduling their next one, there is the no future appointment. And then we have the combined ticket. This will pop up when the patient did not come in for their visit and it was their last scheduled visit. So you're only going to get one of these for your patients. I'm just showing you the 3 different types that you can possibly get. So what happens is these tickets open up overnight, and then you can use these tickets to record your process for contacting the patient and trying to reschedule either their missed appointment or schedule their next appointment. You can update these tickets and say, you called them, they asked you to call tomorrow, or whatever it might be, and then you set it for the next day or whenever they asked you to contact them again. So this is a great way to keep track of everything and record everything, so you're making sure that no patient is falling through the cracks. Just so you know that if you do happen to have a patient that only comes in as they need and they don't actually have any set schedule or anything like that, you can actually turn off the automated tickets for that particular patient. Up at the top right of the patient account, we have this PRM monitoring checkbox, and all you have to do is uncheck that and hit save, and that patient will no longer be monitored for these tickets. Now, when you first decide to turn on these tickets, we usually recommend that you give us a date that you would like to set as your start date, and that start date is any patient that you see or you have seen since that date, only those patients you want to continue monitoring. So we usually open up a ticket to our tech team with that date and let them know what you're looking for and have them go in and turn off this PRM monitoring for any patient that you haven't seen since that date. That way, if you're a little behind on discharging all your patients that have completed their care, you're not going to end up with 1,500 tickets on your workbench with all these patients that you no longer really want to track. You can, of course, if you'd like, just have them all turned on, and that way you can have a ticket to look into each patient so you can see whether or not they need to be discharged, and then go ahead and do so. But that is up to you. But if this is something that you might want, all you have to do is open up a ticket to your SPOC. They'd be able to turn this on for you. And, of course, mention to them whether or not you want that PRM monitoring turned off for patients not seen by a certain date or anything like that. And I think that's about it on the tickets. I'm going to see if I can unmute the lines now. Let's see. And
the conference has been unmuted.
All right, there we go. Why don't we, does anyone have any questions about anything that I reviewed? Okay. It sounds like we don't have any questions. Of course, if you do think of a question later on, you can always open up a ticket to the training team, and we'd be glad to answer any of the questions that you have. Thank you so much for joining me today.